It is such an honor to be nominated as a Castle Connolly Top Doctor, but also an exceptional woman in medicine. Only 7% of physicians are granted this honor, and the Castle Connolly Exceptional Women in Medicine Award recognizes female physicians who have demonstrated leadership, expertise, and dedication in their medical fields. It's not an award you can buy. And it means so much because I'm nominated by my peers. And the goal of this award is to recognize and elevate the achievements of women in medicine, to inspire more women to enter the field, and to advocate for greater representation of women in historically male-dominated specialties and leadership roles, such as plastic surgery. So thank you so much. It is such an honor. I was inspired to become a physician by my father, Dr. Yulo Ambis, who was a breast cancer surgeon. I was also inspired by my mother, Dr. Tiu Ambis, who was a clinical biochemist. She was one of the first women graduates back in 1971 at the University of Toronto. And I come from a family of scientists. Medicine was always part of my life, even before I knew I wanted to be a physician. But I was really inspired by both my father and my mother. Being the oldest of 3 girls, I was told by my mom, you can be anything you want in life. So I never really considered gender to be an issue. I followed my forte in school, which was math and science, and I also followed my interest, which was art. And for me, plastic surgery is a perfect marriage of all 3. Being a plastic surgeon enables me to help people every single day. I get to use my hands. I get to use my brain. I get to use my creativity, my interest in body image and self-esteem and psychology, and it really is a perfect career for me. And if I had to do it all over again, I still would be a plastic surgeon. If I wasn't able to be a plastic surgeon, I probably would do art, maybe be a teacher, maybe work with children. But I just love what I do, and it's really the perfect career for me. When I was in medical school, I learned about plastic surgery pretty early on. I had a mentor, his name was Dr. Chris Forrest, and he was a craniofacial surgeon. Through him, I learned about all the different ways that plastic surgery can help people look more normal, whether they're born with a facial difference, some asymmetry, facial paralysis, or post-traumatically. If there is a major tumor that has to be removed or traumatic facial injury, when it affects your face, it really affects your whole life. You can't hide it with clothing. And so I became involved with About Face International, which is an organization that supports patients and their families who have a facial difference. We try not to use the word deformity because, that's their reality, and they are still beautiful even though they may have a difference or an asymmetry. And so through working with Dr. Forrest, I learned about all the different aspects of plastic surgery, not only craniofacial, but tumor reconstruction, hand surgery, burn surgery, of course, aesthetic surgery, limb reconstruction. And it motivated me to seek training in plastic surgery and to do a specialized fellowship in reconstructive microsurgery. And that involves reconnecting tiny little blood vessels, 1 to 2 millimeters under the microscope, reattaching nerves. And I specialize in one type of breast cancer reconstruction where instead of using a prosthetic device, we can take the body's own tissue, transplant skin and fat from one area of excess, commonly the lower abdomen or sometimes the inner thigh, move it up to the breast as a free flap, and reconnect the blood vessels under the microscope to build a new breast. Specifically within the plastic surgery world, I believe that there's more research that needs to be done with regards to the GLP-1 medications. Ozempic, Wegovy, Mounjaro. You can buy them everywhere. Everybody's on them. And we know that they can cause a quieting of the food noise in the brain. We know that they can decrease cravings for food, for alcohol. There's research that shows that they can help PCOS, polycystic ovarian syndrome symptoms, but they also cause a dramatic loss in skeletal muscle. That's called sarcopenia. And as women age, we lose bony mass, which puts us at risk of osteoporosis. If we also have a rapid loss in our muscle mass, which happens anyway as we get older, but if the GLP-1 medications can accelerate that, that could put us at risk of other conditions. And so I think it's important for plastic surgeons to know exactly how these medications are affecting their patients so that we can guide them on not only how to have the best aesthetic results if they're doing post-weight loss body contouring procedures, but also how to maintain health. And that means good fitness, good muscle mass, good bony mass. So it'd be great to see more research in that regard. Being a woman plastic surgeon makes me relatable to most of my patients. I'm a middle-aged woman, I'm a mom, I'm athletic, I like to exercise every day, but I also like to eat and drink wine and, go to the movies and go skiing on the weekends. When I get to know patients, I say to them, we're going to get to know you really well. We get to know our patients head to toe, inside and out, because we care about you as a whole person. And so I spend about an hour with every new patient, really getting to know them. We go really deep. I want to know about their lifestyle. I want to know about their family. Of course, we go over their medical history. We talk about their kids, their other interests, before we even get to their procedure of interest. And I think being a fellow female helps me to relate to patients on a level where, we can establish almost like a friendship. I tell patients that I'm going to give you the same advice that I would if you're my sister or my best friend. And I have no problem saying no if I don't think that a patient is a good candidate for a plastic surgery procedure. I'll be really honest. I'll explain why. We will talk about the pros and the cons of every procedure, the risks and the benefits, downtime, potential complications. But I'll also say, if you're my loved one, this is what I would recommend for you. And so I'm very honest, I'm very straightforward, I'm kind, and education is always my number one goal when I'm meeting patients, most of whom are women as well.